Hello, good people. How are you today? I hope that you are doing well and today finds you in perfect peace. How about that? So, today is June 17th, which makes it the 17th day of Uterine Cancer Awareness Month. So, as a uterine health advocate, I feel it's very important to align with this initiative and to post information every day during the month of June regarding uterine health or uterine cancer. I also want to say thank you very much for your engagement with this channel, from watching the videos to subscribing, commenting, sharing, liking, all the things. So thank you in advance for doing all of those things, or at least one of those things, right? And so I like to always say it out loud, although it is in my the description below. But I am not a medical doctor. Okay, I'm a uterine health advocate. There's a difference. So, like over the last year, maybe like year and a half to 2 years, I've been hearing about PCOS and seeing information about it online, social media, and just hearing people talk about PCOS. And I didn't know what it was and how it made an impact on my uterine health. So today I'm going to talk about PCOS a little bit because I never heard of it until about a year or two ago. So we're going to find out what it is, right? And again, I just want to let you know, because there was a lot of information out there about PCOS. I do my best in this short snippet to provide you with, I call them high-level bullet points about every topic that I feel concerns, well, not that I feel, but studies show that it, affects our uterine health, whether it be about just general health or cancer, uterine cancer. So I do this to hope that if a topic comes up that resonates with you, that you'll be able to do a deep dive research, which is why I provide at least 3 articles of reference so that you can start your research and go down a rabbit hole and to see if this is something that you can talk to your doctor about, and you guys, both you and your doctor, develop a path of healing and goals for your life and for your body. So that's why I provide this snippet, but just wanted to, throw that in as well. And I do hope that, it encourages you to seek a medical professional and to talk about things that you're reading. Because sometimes when we go places, because we're all different, you just can't slap one Band-Aid on it and say, this is what your issue is, because this is what I've seen in the past. That may not be the case. And just really a quick digress from this, I think I talked about in one of the other videos that I remember a young lady on social media that she was having an issue with her body, and she went to her gynecologist, and her gynecologist kind of like brushed her off. Oh yeah, I know what you need. And she just gave her a general path to healing without taking the time to listen to her, taking the time to hear her symptoms, and come to find out she did go to another gynecologist, which I'm so proud that she advocated for herself. And then she did wind up, I forgot what kind of cancer she had, but she does have cancer. She's still alive. She does have cancer, and it's not to say that because that doctor didn't listen to her, she got cancer, because she says she thinks she already had it at that point. But don't let the doctor just give you a general healing or solution, because we're all different. You have to make them listen to you. So advocate for yourself. So the more knowledge you have, the better equipped you are to say, well, do you think it aligns with the PCOS, symptoms? Even if the doctor's not thinking that way, they might be able to. Let's get into it. Just wanted to give that sidebar of information as well. I hope I'm coming in clear. It's kind of gloomy outside. I try to use the natural lighting. I do have my ring light over here, but I think I'm going to stick with this. So PCOS. PCOS is Polycystic Ovary Syndrome. And basically, it is a hormonal imbalance that occurs when your ovaries create excess hormones. So it's a hormonal imbalance that happens when your ovaries create excess hormones. So it is estimated that that 5 to 10% of women ages 18 to 44 have PCOS. The syndrome is usually detected in women between the ages of 20 and 30, but I did read somewhere that it can start even younger, like when you start having your menstrual cycle, it can start even younger. So the most common signs and symptoms of PCOS includes irregular periods. You may have missed periods, not having periods at all, or it may also involve heavy bleeding during your periods. You could have abnormal hair growth. You may grow excessive facial hair or experience heavy hair growth on your arms, chest, and abdomen area. This affects up to 70% of people that do have PCOS. You could have acne because PCOS can cause acne, especially on your back, your chest, and your face. And the acne continues past your teen years, and it may be difficult to treat. Another symptom of PCOS is obesity. They said between 40 and 80% of people with PCOS have obesity and have trouble maintaining a weight that's healthy for them. So that's why I say sometimes too, I'm going to put another sidebar. We have to be very careful how we talk to each other and give ourselves grace too, because we'll see a woman, she might be what they deem overweight and obese. I don't want to get involved in that and shame and make anyone feel bad, but maybe she might be suffering and she's at the gym, she's eating basically air, salad, and she still can't drop the weight. So it could be something like this that's causing that effect, or it might be some other underlying condition that is causing her to gain weight and she can't lose weight. So we have to be gracious to other people and give everybody, give ourselves grace first, and then make sure we share with other people. So that's that. So another symptom could be darkening of the skin. You may get patches of dark skin, especially in the folds of your neck, armpits, or growing area between the legs and under your breasts. So you can have dark patches. You might have a cyst. Many people with PCOS have ovaries that appear larger or with many follicles. On an ultrasound, they'll be able to detect that. On an ultrasound, they'll be able to detect that. You saw a change in light. That's my motion light that came on. You could also get skin tags, which are little flaps of extra skin, and they are often found in your armpit or on your neck. Many people with PCOS has thinning of hair. Some you may lose patches of hair on their head and even start to go bald. You could have infertility issues, and this is the most common case for female infertility. Not over ovulating regularly or frequently can result in not being able to conceive. So those are some of the symptoms, but I did read that it is possible for you to have PCOS and you don't have any symptoms, or you might have a mild symptoms that are not severe enough for you to notice. So it could be there and you just don't even know you have it, right? And through my study, I found out that there's no specific way to diagnose PCOS, and the exact cause of it is unknown. Sorry for the lighting. I have a motion. Yeah, the motion light's going on and off. So sorry for that. It's not a disco right now. So like I was saying, so it's, there's no specific way to diagnose PCOS, and the exact cause is unknown. They said it could be hereditary. Your mom or your sister might have it, and it could also be due to overweight. This is why I think it is so important to speak to your your doctor or medical professional, and don't let the social media ads and commentaries, because we can get caught up in them. We all can. Things you may find on the internet, diagnose you, and then you maybe take something that you shouldn't, or do something that you shouldn't do. That's not, really part of your healing journey for yourself. So at least if you talk to, that light's going to bug me. I'm going to shut it off in a second. At least if you, talk to a medical professional, you can then see where it goes from there. But don't self-diagnose yourself either. And there's nothing wrong with the ads that people are placing out there. There's ads for every kind of thing that you face, and we see that all the time. But what I'm saying is make sure that you consult a doctor, because you can order something and it might claim to do the things it says, but it may not be beneficial for you based on maybe some underlying conditions that you have, or maybe some medication you're taking, and they just don't blend well together, and it can make you sick. So that's why I say I'm a strong advocate for you seeking your doctor first. Am I against holistic things or other alternative? No. But am I for you going to see your doctor? 100%. So your doctor might diagnose you with PCOS with two or three different types of symptoms. If you have two or three of the following symptoms. So one, if you have irregular or missed periods, or your heavy bleeding that you have during your cycle. The second way is signs of excessive hair growth and acne. And a blood test can confirm this, they said. And you have an enlarged ovaries that they pick up on when they do an ultrasound for you. And many people, you don't always develop a cyst if you have large ovaries, but it can lead to that. So the treatment. So the treatment for PCOS depends on whether you want to get pregnant or not. That is why I say you have to work. Well, I'm going to recommend, not have to. I recommend you working with your doctor to develop a path of healing for your goals and your healing in your life, right? So because they may prescribe you something, but if you don't speak up and say, I want to have kids, and then they may prescribe you something, they may prevent you from having kids. So speak up when you go to the doctor's office, let them know your goal and your plan, and they can tell you something different. I just went to a women's forum the other day, and a young lady, she did want to have children, and come to find out there were so many different underlying conditions that was happening in her body. She had to have a hysterectomy, right? But she worked with her doctor, and it was over a number of years that she worked with her doctor, trying different things and of that. And then because of her health, that was one of the last resorts. It wasn't the first option. It was the last option. Just want to throw that in there. So I always say, work with your doctor to develop a plan of healing for you and your personal goals and your family's personal goals. So I wanted to know, how does this really affect your uterine health? We can see, well, how it does help your uterine health, but that was my main reason of doing a research on PCOS. Like, how does it affect your uterine health? And how it really affects your uterine health is because your irregular ovulation leads to infrequent periods. So that means, because we saw that the ovaries are, excess. I have my notes here. I'm just scrolling back up. I just want to make sure I get it right, because it's a hormonal imbalance that occurs when ovaries create excess hormones. So because of that, you're not ovulating. You're not ovulating the way that you should, and so that causes you to have infrequent periods. And this causes your uterine lining to build up because there's no shedding, which is what happened to me. My uterine lining, but I'm postmenopausal. My uterine lining was getting big because I was estrogen prone. And so your uterine lining is getting bigger. And then it can also lead to uterine cancer, which is why when my doctor saw that my uterine lining was getting bigger, she was immediately concerned, because sometimes that is a sign that you have precancerous or you have cancerous cells. Praise God, I don't have any of them. Thank you, Jesus. Although I do have a biopsy coming up again to check. Just like a screening, just to check. So how it affects your uterine health is, so it can lead to, the thickening of the lining. It can lead to, if it's not diagnosed, or you talk to your doctor, go see a doctor, it can eventually, if they're cancer cells, lead to uterine cancer. And we don't want that for anybody, right? So as an overview for PCOS, it's a hormone disorder that can cause infertility, ovarian cysts, and other health problems, as we can see. Your symptoms can include the long list that I just gave, menstrual irregular menstrual cycles, excessive body hair, acne, fertility problems, thinning of hair. The treatment, like I said, depends whether you want to get pregnant or not, but it includes weight loss. I was reading that, when you lose weight, it kind of changes, much like how sometimes people are type 2 diabetes and then they lose the weight and they're no longer type 2. So, weight loss can do that. They can prescribe you medication. So that's why I say it's really good for you to talk to your doctor to make sure that your goals align with whatever the plan is as well. And, when you've been diagnosed with PCOS, they say you can talk to a number of doctors. You might be talking to an infertility doctor, an endocrinologist, a reproductive doctor. So it could just be a number of doctors that you talk to. Or since I did that thing on board certification, you might be blessed to have a doctor that's board certified in all of it. So you might get one doctor that has like several board certifications, but know that you might have to see multiple doctors or have different types of tests done. So with saying all of that, I wanted to talk about PCOS because that that thing is bothering me. I wanted to talk about PCOS because that's the most common name that we hear out there, right? When people are talking about PCOS. But there's been an update to PCOS, which is another reason why I say it's so important to talk to your doctor, see what's out there on social media. Of course, get a current book or research paper or something that you can look at that can give you up-to-date information. So what I found is that I think as of late May 2026, medical experts have officially renamed PCOS, which was Polycystic Ovary Syndrome. They now call it Polyendocrine Metabolic Ovarian System. So it's now PMOS. So you might see PMOS and not PCOS. Okay. So they changed the name. They felt the name would better reflect the condition, what the condition actually is. And they feel that, changing the name would, center around improving, understanding, and diagnosing and giving proper care for now PMOS, which is Polyendocrine Metabolic Ovarian System. But I'm sure if you tell your doctor PCOS, you'll be fine. So they feel like, that the PCOS applies that the condition is strictly gynecological and defined by ovarian, but they feel like there are other disorders that can add to the PMOS. So that is why they changed it to PMOS and not just limited to just PCOS, right? This is why I say dig deep, guys, and get some information. But I do have 4 articles of reference that might be of help to you if you really want a deeper dive into see what PCOS, which is now PMOS. Yeah. So the first article is from the Mayo Clinic and it's from May 2026. It is it's just titled PMOS. So that's there. And this will be in the description as well. The second one I found was from Tufts Medicine. That's also from May 2026. PCOS is now PMOS. Your questions answered. And I try to, if I find a date, I try to put the date on stuff. So I try to give, stuff not from 19, something that's a little more current, because as you can see, things are changing. They just changed the name from PCOS to PMOS. So the third article I have here is Yale Medicine, Polycystic Ovary Syndrome. It's a fact sheet. And the last one I have is from the Cleveland Clinic, and it's PMOS. It's about that, and it provides you a number of information, a lot of different information about that. So I hope that this was helpful to you. If you were like me, wanting to know exactly what PCOS is, and how does it affect you as a woman, and how does it affect your uterine health. So now we see that this is just another. This video is ending. I'm just going to take that thing down. Now we see that this is another thing that are affecting women that we have to deal with. But thankfully, when you talk to your doctor, we see that there are some measures we can take on our own, like losing weight, or maybe they give you a dietary plan to ensure that, we have a plan towards healing. So I hope this was very informational to you. And it was very informational to me. Like I said, there's a lot of information out there, and be careful as you're doing your research. Make sure you put in the right prompts to ask the right questions, because I went in there and said, what is PCOS? And then I said, what is the difference between PCOS and PMOS? And then I asked the question, how does PCOS affect my uterine health? And that's when I got the information about, the enlarging of the uterine lining, and also it could, it's a small percentage, they say, lead to uterine cancer. So that's why I say, do your prompts carefully as you're online. And again, I hope this information was very helpful to you. So until next time, take care of yourself. If you're having any of the symptoms that I listed below, if you know somebody else, please seek out your local medical doctor and make sure you get a good doctor. We pray for a good doctor. So just pray for a good doctor that you can work with and develop a very good path of healing for you and your body and you and your family. Until next time, take care.